So basically, various type of lesions has been described in strabismus surgery. And this minimally invasive strabismus surgery was popularized by Dr. Mozon in 2007. Basically, for starting this minimally invasive squint surgery, you need the good microscope. Start with the primary horizontal rectus muscle recessions and plaque lesions of 4 mm or less. Preferred age group is between 14 to 40 years, because in very young patients, abundant tenous tissue makes it very difficult, and in older patients, the conjunctiva there is chances of conjunctival tear, and the ideally it should be done in these age groups. These are the various instruments. So basically, in minimally invasive squint surgery, the muscle are operated through several keyhole openings instead of one large opening, and tunnel is created between cuts for additional surgical steps, and transconjunctival suturing technique is used to keep the keyhole opening small. Basically, we have conducted a study regarding this minimally invasive squint surgery with conventional strabismus surgery, and two groups were there for the patients, and the outcome was assessed. So basically, the outcome was assessed in terms of conjunctival redness, swelling, which was graded into 0, 1, 2, 3 as absent, mild, moderate, and severe, and eyelid swelling, and secondary outcome was final alignment. So basically, in the surgical technique, 4 points are marked on the conjunctiva, 2 at upper and 2 at lower end of the rectus muscle insertion, and 2 at the posterior limit of the planned paramuscular conjunctival incisions. 2 small radial cuts are made, one along the superior and other along the inferior muscle margin. Anterior extent of the cut is at the level of the tendon insertion, and size of cut depends on the amount of muscle to be displaced. Basically, the rule of thumb is the incision size should be 1 mm less than the amount of muscle displaced to be achieved. Episcleral tissue is separated from muscle sheath and sclera, and after identifying the border of muscle, it is hooked. And to perform the recession, 2 sutures 60 were applied at the superior and inferior border of the muscle tendon as close as possible to the insertions. And after measurement of the amount of the recession, the tendon was reattached by hangback techniques, and conjunctiva was closed with 60 sutures. So this is a preoperative photograph in group A, and this is a postoperative photograph on day 1. This is postoperative photograph on day 7, and this is at 3 weeks postoperatively. And in group B, the conventional strabismus surgery with limbal approach was done, and this is the preoperative photograph. This is post-op photograph at day 1. This is at day 7. It is at 3 weeks. So post-operatively, the assessment criteria were eyelid swelling, conjunctival redness, and chemosis. Basically, there was no significant difference between both groups regarding the preoperative and postoperative amount of the deviation. However, significant statistically difference was seen in severity of redness in both groups at different point of times, and conjunctival redness was almost absent by 3 weeks in the minimally invasive squint group as compared to the conventional group. Then there was statistically significant difference in the severity and mean swelling in both the groups at different point of times. So, however, after 3 weeks, both the groups have similar outcomes. So, whatever differences was there, that was between in the initial 3 weeks. So, advantages of minimally invasive squint surgery includes the placement of conjunctival incisions away from the cornea, then minimizing the size of the incision, improved postoperative quality, better cosmesis, minimal tissue disruption, and improved function of the affected muscle, less trauma to the operative area, and ease of performing the revision surgeries. So, I would like to conclude that this minimally invasive squint surgery should be tried in whatever cases it is possible, and for initial 3 weeks it is better technique as compared to the others. Thank you, sir.
Thank you, Dr. Subhash. I think how much is time taken? I think you would be probably taking more time with minimally invasive as compared to,
sir, in the initial learning cover, the time will be more, but once you perform, then there is not much difference.
And other thing is, younger children you can't do in older people. Younger children do have a lot of tenons also. So,
yeah. So ideal group is 14 to 40 years.
But by 40 years, conjunctiva starts getting fragile, so
Yes.
it's better to probably have a fornix incision. I mean, limbal incision, older people find limbal is better than having a
Yes.
fornix one. So it's good procedure, but I think one has to select patients.
Selection criteria is very important.
And ultimately, results are similar, so it's
Yes.
not very different.
Yes.
Thank you, Dr. Subhash.
Thank you, sir.